I've had this persistent lower back pain.
That's one of the signs we need to monitor. There are 8 common indicators.
What if I told you that the silent killer, prostate cancer, is quietly diagnosed every 2 minutes in men across the United States? And yet, most men in this country, particularly those over 60, will refuse to talk about it until the symptoms are screaming. Despite being the second leading cause of cancer death among American men, did you know that 1 in 8 men you see walking down Main Street, from Miami to Seattle, will be diagnosed with prostate cancer in their lifetime? That means in any gathering of fathers, brothers, sons, or friends at a Sunday football game in Texas, someone you know is likely to be affected. Prostate cancer still hides in the shadows of American men's health discussions. Why is that? It's not because we lack the science. Today, we have cutting-edge tools like PSA testing, MRI-guided biopsies, and even genetic screening, often covered by Medicare, to detect risk early. The problem is the silence. The male culture of toughing it out, ingrained since childhood in school sports and military service, or simply avoiding the annual checkup at the VA clinic, creates a deadly gap between detection and action. And in fact, some forms of prostate cancer are so slow-growing that with early intervention, they can be monitored rather than aggressively treated, but only if they're found in time. Here's the real question. If men in the USA are living longer than ever thanks to modern medicine, why aren't they living healthier? The answer lies not just in biology, but in the ingrained behavior of avoidance. Studies show that American men are far less likely than women to seek preventive care, and prostate health is one of the biggest casualties of that reluctance. The irony, prostate cancer caught early has a nearly 100% 5-year survival rate. That means American lives are being lost not because we can't treat it, but because we're not talking about it. In this video, we're breaking down the science, busting the myths that keep men silent, and challenging the stigma around men's health, one truth at a time. Because the first step to saving lives is starting the conversation. Prostate cancer. It's one of the most common cancers in men. Yet, it's also one of the most misunderstood and dangerously overlooked. Why? Because its symptoms are often subtle, easily mistaken for normal aging, or ignored altogether by a man focused on his golf game or his retirement plan. Frequent urination, difficulty starting or stopping a stream, or even dull lower back pain might not raise alarms, but they should. Unlike some cancers that shout, prostate cancer often whispers, and by the time it speaks loudly, it may have already spread. That's why awareness and early detection aren't just helpful, they're critical. In this video, we're diving into the science behind prostate cancer, breaking down the early warning signs you should never ignore, and showing you why getting tested could mean the difference between spending retirement with your family and facing a devastating diagnosis. Whether you're a father over 40, have a family history, or simply want to take control of your health, now is the time to learn, act, and start the conversation. Stay tuned till the end where we'll share the gripping story of a prostate cancer patient, a successful retired mechanic from Tampa, Florida. One that's both eye-opening and deeply urgent. It's a real-life journey that reveals just how dangerous this disease can be when left unchecked. You won't want to miss the lessons hidden in his experience. This story could change the way you see your health forever. One of the biggest myths about prostate cancer is that it's a disease only older men need to worry about. But that's far from the truth. While the risk does increase with age, men as young as their 40s in places like New York City have been diagnosed, especially those with a family history or certain genetic mutations like BRCA1 or BRCA2. The real danger: far too many men brush off early symptoms as just getting older. Trouble urinating, pelvic discomfort, or even erectile dysfunction are often chalked up to stress, bad diet, or aging, and never get checked out. This silent denial creates a ticking time bomb. Prostate cancer in its early stages is highly treatable, sometimes even manageable without aggressive treatment. But when ignored, it can spread to the bones, lymph nodes, and beyond, becoming far more dangerous. Compounding the issue is the fact that men on average are much less likely than women to seek medical advice or undergo preventive screenings. That hesitation combined with misinformation leads to thousands of avoidable deaths each year. It's not just a medical issue, it's a cultural one in America. Breaking the silence around prostate health isn't just about spreading awareness. It's about changing the way men think about their bodies, their health, and their future. Here are 8 sneaky signs of prostate cancer. Each one subtle, easy to dismiss, but potentially life-saving if caught early. Understanding these signs can empower you or a loved one to take action before it's too late. 1. Frequent urination, especially at night. Waking up multiple times to urinate might seem like a normal part of aging, but it can be an early red flag. An enlarged or cancerous prostate can press on the urethra, disrupting normal urine flow and bladder control. 2. Difficulty starting or stopping urine flow. If it takes extra effort to begin urinating, or if the stream feels weak or interrupted, pay attention. This can be caused by a tumor pressing against the urethra or blocking part of the urinary tract. 3. Pain or burning sensation during urination or ejaculation. This isn't just uncomfortable, it could be a sign of inflammation caused by cancer or related conditions like prostatitis. Many dismiss this as a urinary tract infection or irritation, but persistent pain deserves immediate medical attention. 4. Blood in urine or semen. Any trace of blood in urine or semen, no matter how small, is a serious signal. While it could indicate other conditions, it's a known symptom of advanced prostate issues, including cancer that's beginning to spread or cause internal damage. 5. Erectile dysfunction or difficulty maintaining an erection. While common with age, sudden or unexplained erectile issues may stem from prostate problems. Tumors can interfere with nerve signals or blood flow necessary for a normal erection, making this a symptom that should never be ignored. 6. Persistent pain in the lower back, hips, or thighs. Prostate cancer that spreads often targets bones in the lower body. If you're experiencing consistent dull aches in these areas, especially if they don't respond to typical treatments like Tylenol or heat, this could be a warning sign of metastasis. 7. A feeling that the bladder is never fully empty. Even after going to the bathroom, do you feel like something is still left behind? This sensation often comes from a prostate growth pressing on the bladder, limiting its ability to fully empty and increasing the urge to urinate. 8. Unexplained weight loss and fatigue. Sudden weight loss or constant tiredness without changes in diet or activity can be an indication that cancer is affecting your body's metabolism. When combined with urinary symptoms, these signs should raise serious concern. Each of these symptoms on its own might not scream cancer. And that's exactly why prostate cancer can go undetected for so long, but together they paint a picture the body is trying to show. If any of these feel familiar to you or someone you love, don't wait. Talk to a healthcare provider. Early detection isn't just better treatment. It's better chances at life. Let me tell you about Frankie the Wrench Rizzo, a 62-year-old retired garage mechanic from Tampa, Florida, who prided himself on his self-sufficiency and never once asked for help. He brushed off his frequent need to use the bathroom, blaming it on increased iced tea intake in the Florida heat, and ignored the dull ache in his lower back, thinking it was from years of bending over engines. Months passed, symptoms worsened, and finally, at his daughter's insistence, he got checked at the Tampa General Hospital. The diagnosis, stage 4 prostate cancer, already spread to his spine. He was shocked. He looked and felt tough, yet cancer had been silently growing for years. Frankie now shares his story publicly at local men's clubs, urging men not to confuse toughness with immunity. His biggest regret? Not listening to the subtle signals his body was giving him, the same way he would listen to a small knocking sound in an engine. His experience is a powerful wake-up call. Being tough doesn't mean being invincible. Early detection is the real strength. If this video resonated with you, like, share, and subscribe. Your support helps spread life-saving awareness. Drop a comment below if you or someone you know has faced these symptoms. Share this with the men in your life. One click could make a difference.